Hi, Dr. Soraya here. This video is a response to a recent comment on one of my videos related to a specific medication. And I'm making it because it seemed to me that the comment was distorting certain aspects of psychiatric drugs and psychiatric treatment and making false claims about statistics and things that I simply think are misrepresentations, sort of to follow a particular anti-psychiatry agenda. The commenter made the assertion that only 12% of people have any benefit from psychotropic medications, and 100% of people have massive, horrible, debilitating side effects, and 100% of people have terrible, intractable withdrawal symptoms, and really none of these people is actually improving, and that they're being misled and drawn away from things that could actually help them. And so I want to address a whole string of things I think that is misleading about this comment. So first of all, there's an implication that the placebo response doesn't count. And this is a very common approach when people are attacking the potential benefits of psychotropic medication. So there can be a very large placebo response, but a placebo response is still a response. Placebo is not a criticism or an assertion that the response is not real. The experience of a person who benefits, and we say that they had a placebo response, their actual benefit is no different than the benefit from someone who is, quote unquote, actually benefiting from the mechanism of whatever drug or intervention we're talking about. And this is a very important thing to understand, that you can't simply say and discard the benefit of people that you ascribe to placebo. Whether it's placebo or directly attributable to the intervention, the response is still a real, genuine response. So this subtracting placebo out and saying, well, only 12% of people really benefit is a inaccurate and misrepresentation of how we actually think about an individual's response to a medication. Now, I understand that the fact that there may be a large placebo response, we may want to find and continue to look for other interventions and options that may offer a more robust response. That's fine, but we shouldn't throw out what's already working in the process. So the other aspect of the comment where they say, so if you have 12% of people benefiting, therefore 88% of people are dealing with all these horrible side effects and miserable withdrawal with no upside. So the idea that 100% of people who take a particular medication or class of medications are going to have the worst and most extreme side effects and withdrawal effects is preposterous. So first of all, not everyone has any adverse effect to taking a psychotropic medication. There are indeed many, many people who take these medications with benefit in the absence of any adverse response. There's many people who do have some mild side effects, and sometimes they don't go away, but these people are, of their free will, choosing to continue to take the medications, not because they're being brainwashed by their psychiatrist, but because they, as independent decision makers, recognize that the benefits clearly outweigh any adverse effects for them, and they're choosing to continue. And then you will have people, a small percentage, who do have some adverse effects that lead them to decide not to take the medication, and that's perfectly fine and valid, and I completely agree with that. The other detail in this comment that I wanted to address is this false dichotomy between you can either get treatment with a psychiatrist or you can see a therapist or someone who works in another modality. And that is a false dichotomy. First of all, I myself see patients for psychotherapy. So contrary to the assertion of the commenter, it is not the case that no psychiatrists are aware of treatment options other than prescribing medications. It's not the majority of psychiatrists, but there are plenty of psychiatrists who see patients for therapy and or certainly have had some training in and understanding in doing so. So some of my patients I see for therapy, others I see just for medication management, but I certainly encourage them to work with a therapist at various stages of their treatment. And I also encourage them to pursue whatever modalities might be of benefit, assessing what are the risks, what are the possible benefits, and making a decision about whether it makes sense to do a trial. The same way I approach considerations related to medication. So I just wanted to comment on these things, that the numbers in the comment are not accurate. The absolutism and the idea that every horrible side effect is definitely going to happen to everyone who takes psychotropic medication, that is completely false. And finally, the idea that psychiatrists are only interested in getting patients onto medication and don't want them to seek therapy or other possible modes of treatment is also completely false. And I am thankful to this commenter, because the presence of this distorted message that everybody who tries psychiatric medication will have a terrible, terrible side effects and no one should see a psychiatrist as a result is the exact message that led me to starting my channel. So I hope that I can offer a more moderate and realistic view as to what the possible responses and reactions are to taking psychiatric medication, and push back a little bit on this very absolute and very dangerous idea that that somehow psychiatrists are completely ignorant, uncaring, and prescribing medications that are only dangerous and offer benefit to a tiny minority of people. These things are all absolutely false. Many, many, many people benefit from medications, and it's a good thing that we don't apply this logic to other areas of medicine. If we had had this kind of treatment of something like penicillin, there are people who have had fatal allergic reactions to penicillin, and not just one or two, many people over the years. But if we took that information and assumed that that dictated the response that everyone would have, we not only would not have penicillin, we wouldn't have antibiotics. And that is not a world that we would want to live in. Millions of people have been benefited from antibiotics. Millions of lives have been saved. And I would say that the very same applies to psychotropic medications. Yes, there are people who unfortunately have had very severe adverse reactions. There are many, many, many more people who have benefited and had their lives saved. And I want to get that message out there. Thank you.